Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. This is episode 213 of the Everything Medicare Podcast. My name is Christian Brindle. I am your host. Every single week, me and my company bring you a podcast episode where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And folks, we are on episode 213 of the Everything Medicare Podcast. Today we're going to be talking about why my company offers Medicare Advantage plans as well as Medicare supplements, and why we really don't have a bias towards one or the other. I got this question asked to me recently by someone who's a listener of the show. I guess they listen from pretty religiously, actually, which I certainly do appreciate, and we appreciate every single person that does listen to us, even once, because it helps us reach more people just like you who need to hear our information. But basically, I was talking to this person on the phone in the last week or so, and they asked me, they said, Christian, your content is very good. It's very informative. We really appreciate it, stuff I very much appreciate. And they said, they're like, I noticed people that have other, shows or, YouTube channels, just people that other than you that talk about Medicare. A lot of them typically, very heavily and very, very publicly, actually, offer a bias opinion towards either Medicare Advantage plans or Medicare supplements. As many of you may know, if you've listened to me for a while, we beat this to death. When you turn 65 and get onto Medicare, you have the option of going either Medicare supplement or Medicare Advantage plan. And in my personal opinion, I do not believe that one side is better than the other. I think that they're different. And I think everyone has different needs and preferences. And so we've always taken the approach to offer both, talk about both very openly, and actually probably go out of our way a little bit to kind of explain both side by side to people so they can kind of get a really, really good overview so that way they can make a more informed decision. I've certainly had people come to me over the years that just want me to say, well, what's the best thing? And my response is never something that they like. I'm like, there is no best thing. It just depends on what's best for you. And I'm like, can we have a conversation? Can we talk about your needs? Can we talk about what your life is like, what your situation is like, what your health needs are like, what medications you're taking, what doctors you're seeing, how often do you travel? I need to know everything. The more information, typically the better in terms of that. And that will help me make a better recommendation for you. But anyway, there are certainly people out there that do similar things to us and put out information that very heavily push people towards either Medicare supplements and they try to demonize Medicare Advantage, or vice versa. They push people towards Medicare Advantage and they try to demonize Medicare supplements. I've seen both ends of this equation, and it's not even always people that, are people that put out content and shows like I do. It's a lot of times people that are insurance agents that are out in the field working with people. They come to your home on a regular basis. They have these opinions. And I'm just not of that belief. Now, why do these people do this? Why do they push it towards one side or another? Well, it always, 150,000% of the time, comes down to what best serves their interests. They could not give a damn about you. And I hate to say that to you. And I truly do believe that. I think anytime someone gives you an ultimatum in terms of this is going to be the best thing for you all the time, any person that gives you what I would call absolutes in the Medicare world, not just the Medicare world, I think it's anything, I think is going to be not serving your best interest. Think of it like this. Let's say you're buying a smartphone. And let's say you've never bought a smartphone before. Let's say you live under a rock. Most people listening to this, I would like to assume, probably own a smartphone of some kind. So what are the two most notable types of smartphones out there? Of course, there's off-brands and things like that, but what are the two kinds that eat up 90% of market share, if I had to guess, without looking at the numbers? iPhone and Android. Is one more popular than the other? Yeah, I would say so. But do both of them have their strengths and weaknesses? I've talked to people that have iPhones. I personally am an iPhone user, and I love my iPhone. I'm on it probably way more than I should be. But there are certainly people that look at the iPhone and they say, I like the design, I like the layout, I like the simplicity of it, I like that I can use my finger and drag and drop and touch the apps, and they just love the whole setup of the iPhone. And Apple's known for their artistic viewpoint. I'm a big fan of Steve Jobs, the late great Steve Jobs, and Steve Jobs would always say that, he'd put passion into his work by trying to make, his product lines attractive, if you will. He didn't want them to look ugly. He looked at them almost like a painting, like a piece of work, a piece of art. Whereas probably all the other technology companies really never put a focus on things like that. So there's definitely a intellectual feeling you get in terms of using an Apple product. And I think anyone that uses Apple products, whether it be a MacBook or things like that, get that from the equation. Whereas Androids, they have things about them that people like as well. I've heard that, and I've heard several Android users tell me that they really like the functionality of them, and they feel like they can do a little bit more things. They have more capability a little bit. It's going to be a little bit more techy for people that are more, maybe tech savvy or that kind of stuff. And I'm sure there's other things, and I'm sure I'm oversimplifying it quite a bit. But the point of the matter is, if you've never bought an iPhone before, or you've never bought an Android before, you've never had a smartphone of any kind before, and you're in the market for a smartphone, should you maybe pick up an Android phone and play with it and go through it and kind of see how you like how it's set up, and then should you also put it down and go pick up an iPhone and kind of compare it and kind of be like, okay, I like this one a little better. We're all individuals in terms of what our needs are, in terms of what we're going to use the product for, and in terms of what we just like, right? I mean, you don't like the same things I like. I don't like the same things you like, at least not down to the very last detail. And so getting onto Medicare is no different than that. It's the same thing as, would you rather shop at Walmart or Amazon? Walmart, no, maybe not the greatest example because Walmart is trying to do more and more stuff online and compete with Amazon, but I would be willing to say, without knowing the statistics, just guessing, that Walmart probably still does much more business in retail than they do online through e-commerce. Walmart's basically looked as a retail location, where Amazon is looked at as the opposite of retail. The death of retail is what they've called Amazon. But there's still a huge amount of people. I was at Walmart last week. It was packed. Sea of masks is what I saw. And the people at Walmart chose to get up, go to Walmart. I mean, here's the thing about Amazon. Even if you have Amazon Prime and you're taking 2 days to have something shipped to you, you're still not going to get as fast as getting up, driving to Walmart, picking it up and going home. And there will always be some kind of attraction to that. But there's definitely the people too that don't mind waiting a few days, and they love that they don't have to get out of their chair or get off their couch. They can just get on their phone, touch a few places, touch a few buttons, and on the Amazon app, and boom, you're done. Free shipping if you have Amazon Prime, 2-day shipping. So not everything is black and white in our lives. In fact, I would argue most important things are not. Getting onto Medicare is the exact same thing. Whether you want a Medicare Advantage plan, there are certain reasons for that. Maybe you're healthy. Maybe you don't want to pay a lot of premium. Maybe you can't afford any additional premium above the Medicare Part B premium of $144.60. Maybe you like the extra dental, vision, hearing benefits. Maybe you like the simplicity. Medicare supplement, maybe you need the extra coverage, or maybe you're healthy, but you're afraid you might not always be. And you like that top level coverage you get with a Medicare supplement plan. Everybody's going to make a decision for their own reasons. You might have situations that are similar to one another, but everyone's going to make a decision for their own reasons. Because all of us are unique. And that, my friends, is why we offer Medicare Advantage plans and Medicare supplements here in our office, because I don't believe that it is my right to take that decision-making process away from you and to put you into a box and tell you something that is right for you every single time, regardless of who you are, regardless of what you've been, where you've been, regardless of what your experiences have been in your life, regardless of where you're at today. I'm not arrogant enough or selfish enough to put you in that box and to tell you you need a Medicare supplement every time a Medicare Advantage is evil. Self-serving narrative. I'll talk about that in segment 2, exactly how it's self-serving. But also, in my opinion, arrogant, because you think that every single situation is going to fit into that box, and it's not. It's always self-serving. Folks, I have to take a quick break. I'll be back with you in segment 2 of this episode, and I will go over exactly why people push you towards one direction or another. It's not because they believe something's better for you. Maybe they do a little bit, but they think it's better for them for you to be on that plan. Don't go anywhere. We'll be right back. You're not going to want to miss what I have to say about this. We are back with segment 2 of this episode, 213 of the Everything Medicare Podcast. Quick announcement before we get into this second segment of this episode. So today is Monday. Today is Monday the 10th. On Thursday of this week, the 13th, it'll be my birthday. I'm going to be turning 28 years old. It's amazing to think. I've been working with people on Medicare since I was 20. It's amazing to think pretty much my entire adult life I've been doing this. I've got 2 years left of my 20s, and then I'll be 30, and I'll basically been doing this a decade. And I won't be working. Our office will be open. My staff will be working, but I will not be. Our staff will be here, but I will not be. I'm taking the entire day off, not taking any phone calls. So any person that listens to us regularly that's a client of ours, I will not be in Thursday for that reason. But doesn't mean our office is not open. If you need something, one of our staff members can help you if you call during the day. So anyway, folks, let's get into this. Why would an agent or a person online that paints a rock-solid argument, narrative that's so convincing to push you towards either Medicare Advantage or Medicare Supplement, why would they do that? Is it because they honestly think that's what's best for you? Maybe slightly, but the number one motivator is not going to be that they're just nice and they're trying to look out for you. It's because, like I said in the last segment, it is going to suit their interests every single time. 7 days a week. 8 days a week, as the Beatles once said. And this is what those interests are going to be. Depending on who you talk to, an agent will love to have a Medicare Advantage enrollment, an agent will love to have a Medicare Supplement enrollment, and they'll be completely biased towards the other side of the coin. Of course, us as agents, and I've gone over this before, we get paid commissions based on someone enrolling with us. And I've done an entire episode about that. If you haven't heard that episode, let me see if I can find what number that is. We've done so many episodes, so if it takes me too long to actually find the episode number, then I'm just going to move on and you can find it on your own. But I'm going to see if I can find it real quickly here. It's called How Insurance Agents Get Paid, I believe. I'm looking for it. Bear with me, folks. We have so many episodes. Looking. I'm not finding it. I have no idea when I did that episode, but I believe it was in 2020. We've just done so many episodes, so they kind of just all mush together in my mind a little bit. And we put so much into the show. I can't tell you what episode number it is. It's on there. We've done it. I guarantee it. But anyway, I'll quickly break down what the biases are for these agents. The agents that basically cram Medicare supplements down your throat do it for this reason. They might have produced a lot of business for a particular insurance company or several, and they might, because of this, when an agent is able to do that, the insurance companies can give them higher commission level contracts. And because of that, they're able to make more money. So in that case, they might make more money on a Medicare supplement plan in terms of commission than they will on a Medicare Advantage. So there's obviously that motivating factor. The other motivating factor is there's little to no customer service in the Medicare supplement world. It's quite simple. Medicare pays first, supplement pays after. There's no copays, there's no bills, there's no networks. So there's very little customer service, and agents like that. They feel like they can keep the clients on the books and continue to grow. And they spend a fraction of the time dealing with customer service than they would with a person that has Medicare Advantage, because a person that has Medicare Advantage has drug coverage involved, networks involved, all these different variables that can kind of show their face a little bit. And not only that, agents might not like to take the certification test that they need to take in order to sell Medicare Advantage plans or offer them to their clients. I've gone over this before. Medicare agents have to go through a litany of certification tests. They have to pay for one of them in particular called AHIP to become AHIP certified to offer Medicare Advantage plans. And there's a lot of hoops for them to jump through. So a lot of agents just think it's not worth it. And so there's a lot of reasons why it might behoove them to only offer you Medicare supplements. Let's talk about the Medicare Advantage side. The Medicare Advantage side, an agent will make commissions on a Medicare Advantage plan as long as you're enrolled with them. They call it lifetime commission in the industry. Whereas with Medicare supplements, there's typically an expiration date. It could be 6 years, could be up to 10 years. It just depends on the insurance company that the person enrolls you into, typically. And so with Medicare Advantage plan, they don't have to worry about that commission expiring as long as you're enrolled with them. And they also, if they might not have those higher Medicare supplement contracts, they might make more money selling Medicare Advantage. An agent gets paid pretty well on Medicare Advantage for the most part. And so they might have what we call in the industry commission breath. They're thinking of it, they're thinking of their wallet. I personally could care less. what we do for somebody. I'm just grateful to have you as a client, as a customer. I'm grateful to have your business. And I just want to help you find the best thing for you, because we want to have a long-lasting relationship with our clients, a long-lasting relationship with our customers. And because of that, I understand that if I do the best thing for them possibly, they're going to want to stick with me over the long haul. That's how you grow a business. That's how you do good business. Not self-serving, slimy, sneaky business. Anyway, folks, something that I wanted to touch on, because I had someone ask me that question. It's not the first time this question's come up. Why do you offer both? Why don't you lean heavily towards one or the other like some of these other guys do? It's because I actually care about you, the client. And all those other people that heavily push you one way or the other don't. In my opinion. Allegedly, right? Let's cover my butt. Anyway, folks, I hope you enjoyed this episode. If you did, you're always welcome to reach out to my office and talk with me. We're licensed in 10 states to work with you. We have access to all of the different insurance companies in the industry for the most part, where we can basically find you the best available fit based on your needs and preferences, whether it be Advantage or Medicare Supplement. Those states are Utah, Idaho, Colorado, Oregon, Washington, California, Texas, South Carolina, Virginia, and Florida. Again, that's Utah, Colorado, Idaho, California, Texas, Virginia, South Carolina, and Florida. Our office number is 801-255-5340, 801-255-5340. We are Christian Brindle Insurance Services. My name is Christian Brindle. And thank you so much for taking some time out of your Monday to listen to me and be with me here today. Hope you have a fantastic week. Enjoy the summer while we can. Won't be around much longer. And until next time, folks, thank you for taking the time. We appreciate you. We love you. We'll be back with you with another episode next Monday. Take care.